All right, let's take you to this now. The Center for Diabetes and Endocrinology has unveiled groundbreaking solutions that promise to revolutionize diabetes management. These innovations, comprised of 2 devices, offer a needle-free approach to monitoring blood sugar levels. One device is worn on the arm, while the other is a mobile handheld camera capable of detecting complications associated with diabetes and other diseases. With over 4 million people living with diabetes in South Africa, these innovations aim to empower individuals living with diabetes. Now, Dr. Grant Newton is the CEO of the Center for Diabetes and Endocrinology. He joins us now to unpack this further. Doctor, thank you so much for your time. I would imagine that given the complexity of diabetes as a chronic and long-term condition, these devices are welcome news, given firstly they are pain-free. Talk to us about the benefits here.
Thank you so much, and really appreciate the time this afternoon. Yes, absolutely. I think you also, if I may, you mentioned 4 million people living with diabetes in South Africa. I shudder to announce that there's probably a lot more. And in the environment that we're in right now, in the communities that we're in, we're not testing. We're not finding ourselves in a situation where, firstly, government has the capacity to test, and private sector sometimes even the inclination based on different agendas. But I'm very pleased, as you've just rightly said, that we are attacking this problem with vigor. And the first device, and maybe we do this sequentially, if it works for you, is to say that we need to find the disease first. So this, what looks like a gun that I'm holding in front of me today, it's, if you remember correctly, if you've got your glasses, which I see you wearing, if you got glasses, you went to the optometrist and you would have had your eyes photographed, and there was that big red ball on the screen.
Yeah. This
is exactly the same diagnostic device, but it is effectively, as you can see, being democratized. We can take this now into communities. It does not require a clinician to operate the device. It operates on the basis of the fact that a person can take the photograph, and the photograph, in essence, of the retina gets sent using data to artificial intelligence. And artificial intelligence, which has been approved by the FDA. And let's just be clear, we're not talking about ChatGPT, etc. We really are talking about clinical science AI. The AI then comes back literally within 30 seconds and gives us a report on a number of diseases, which includes diabetes, but also extends to hypertension, dyslipidemia, which is cholesterol, and other diseases, which in fact, also looking at neurological diseases now, the likes of dementia, Parkinson's, Alzheimer's. All of these are in our near future. And so these devices that we bring are not invasive and allow us to get access to data and be able to create community positions to understand how do we bring resources to the communities.
So I imagine that the devices are just for, detection purposes, of course, just testing out for blood sugar levels, not necessarily treatment component of it. And more importantly, of course, you are showing us the one device, which is the camera-like. There's also another one, I'm told, that you can wear around your arm.
Indeed. In fact, I'm busy wearing one right now. It would be remiss of me, I think, for me to take my shirt off on TV. But I am wearing a device. It's about the size of a 5 Rand coin. And that device is sending continuous detail to my phone. So you remember that at the moment what happens here, Gugu, is that people are expected to finger prick themselves, to bleed, and to take the blood and put it into a device called a glucometer. That glucometer then gives you a reading which in many instances can save lives, because it's an indication of whether you should be taking insulin right now. It's an indication whether you're going into hypos or hypers. And often, unfortunately, people are not testing. And the back of the fact that people are not testing is access to devices, or access to effectively to testing kits, but also the fact that people don't like to bleed. And you can imagine, if I may use quickly an example here, is that a type 1, and remember we're living with 2 types of diabetes in our country and globally. Type 1 diabetes is a genetic disease. It's a disease that's passed down, and that affects children in our world. And if you have to go to walk through the hospitals, you'll often find that there are children lying in beds at the back of the fact that they've ended up in diabetic comas. In order to stop that, what is necessary is that their mom or their dad or someone who's their guardian at night will potentially have to wake them up to finger prick them, to find the blood and to put it into a machine to see what their levels of glucose is at that time. Well, now I'm very pleased to tell you that the sciences have moved us into a completely different area. And as you can see, I get now, according to this little device sitting on my arm, I get readings every 3 minutes of what's happening.
Yeah.
We link them in essence to alarms and detections, and very quickly we can get that mom or that dad to wake the child up gently and to say, we need to bring up your sugars because effectively we've gone into a really deep low. And in the areas of type 2s, insulin-dependent type 2 specifically, these are definitively life-saving devices. It helps people to understand their disease, understand exactly what their behaviors are, and it extends beyond that, by the way, into people who are living with obesity and weight management issues. These devices help them to change their behavior as it relates just the same way as it does in diabetes to their eating habits and their lifestyle habits, which we hope we can use to stem the scourge of the disease that's happening in the country at the moment.
Now, of course, just given the scale in terms of the number of people that have either type 1 or type 2 diabetes in this country, the other concern that you've also raised is that people are not testing. Of course, we're also hearing that people are also not getting the proper treatment. So people watching here want to get access to these devices. It's great innovation. But I mean, at what cost? Is it something that is going to be able to be afforded across South Africa? We know, of course, the economic climate in this country. And because of the life-saving component of essentially, getting tested on time and also getting the treatment, how accessible are these devices?
Well, let me answer your first point, and that is that you remember that diabetes lives in your system for the best part of 12 years before it manifests as a symptom. Wow. Now, that's hugely dangerous because what it's doing is it's starting to destroy your vascular system. So by the time you manifest with symptomatic disease at your GP or at pharmacy or at a nurse, by that time you've already got damage. And so we're trying to stem. If we can catch this early in the communities using, and let me tell you that these devices, the one that I'm showing you at the moment, these devices are very cost effective. It's in essence the equivalent to taking photographs. The cost of photographs on your phone is the cost of the equivalent. The AI reports are very cheap and very accessible, and these things can place very costly blood-based technologies or blood-based tests that people just don't go for. They don't go and get their glucose tested on a regular basis. From an access perspective, we are bringing these devices to high street retail pharmacy, into general practitioners' environments, and the CD is rolling out what we call chronic diagnostic centers across the country, where people can have direct access to getting their eyes tested, and through their eyes, we can be able to see whether they've got, as I said, diabetes, hypertension, cholesterol issues, and even chronic kidney disease. And these things are extending continuously as the AI starts getting approved through the likes of the Food and Drug Administration in the US. So testing can become ubiquitous. The cost of these devices, the one that's on my arm, these devices, we're talking to government, to Department of Health, and amongst other, of obviously NGOs, etc., across the whole African continent, to see if we can get volumes. Volumes effectively drive down prices. And then we can talk to manufacturers across the world of being able to say to them, now we've got bulk, and in bulk we'll be able to make an effective price point very accessible, both for government and for private.
I'm glad you mentioned the fact that you are in conversation with government, because that would then address, how these devices can then access the remotest of areas, in the country. But very lastly, Doc, before I let you go, just talk to us about the situation on the ground in as far as type 2 diabetes is concerned, because I am hearing you that this can be life-threatening. We also, of course, understand that, this is also on the rise in the country. How worried are you about the numbers in the country increasing, particularly as it speaks to diabetes type 2?
You addressed the point around 4 million people potentially that we know that have diabetes in the country. We are suggesting that for every 4 million, the 4 million that we know of, there's probably another 8 to 12 million people that are living with the disease, either unknowingly or even knowingly, and allowing the disease to effectively take control of themselves. Lifestyle is an absolute imperative. Nutrition is a major problem in our country because we've got a very high carb, high diet, refined sugar diets, fizzy drinks and etc. is what the people grow up on. And these are the things that are starting to destroy our communities. We need to get into the heart of our communities. And I have to say that in our engagement, the team's engagement with government and certainly the minister himself, there's definitely a willingness to do it. It's the ability of how do we do it. So to get devices onto people's arms, to get people tested using the cameras, etc. These are accessible points, and these things, as everything takes, unfortunately, takes time. But I will say in my last comment there, is that we need to also address nutrition. And at CDE as well, we've started to launch nutritional ranges that are accessible to people to do meal replacements. Very low calorie diet type shakes and bars and supplements, which allow people then to replace those high carb and high refined sugars. And if I can leave you with one very, very simple, eat your protein first before you eat the high carb or the high refined sugar. I'm not going to go into the summary of looking at how the metabolic system works, but it certainly helps that if your system starts attacking the protein first, it allows then the energy to start looking after those carbs and refined sugars. But the bottom line is, try and stay away from them. They really are killing our people in both the country and the continent.
Dr. Newton, thank you so much for your time. Of course, sound advice there that I hope many are listening to. Thank you so much. Dr. Grant Newton is the CEO of the Center for Diabetes and Endocrinology. He's joining us there to talk about these two groundbreaking devices that may help in the detection of, in diabetes, of course.